What are joints? Joints are the places where two or more bones meet. There is more joints than bones, and that's because one bone can have more than one joint, and usually it does. Besides muscles and bones, joints are the reason we can move.
Joints are classified by structure and by function. The structural classification focuses on the materials binding the bones together and whether or not a joint cavity is present. Structurally, there are fibrous, cartilaginous, and synovial joints. When we are discussing the functional category of joints, what we mean by function is how much the joint moves, how much movement is allowed. There are three types of functional categories. There's synarthrosis, which are immovable joints. They do not move at all. There are amphithrosis. These are slightly movable joints. And there are diarthrosis, and these move freely. In fibrous joints, the bones are joined together by collagen fibers of connective tissue. There is no joint cavity present. An example of this is a suture. A suture is a joint held together with very short interconnecting fibers and bone edges interlock. This is found only in the skull. Gomphosis are peg and socket fibrous joints. The only example we have of a peg and socket gomphosis fibrous joint is in a tooth socket. In syndesmosis, the bones are connected exclusively by ligaments. This is found in the fibula and the tibia. The amount of movement allowed at the syndesmosis depends on the length of the connecting fibers. So it can either be synarthrosis or immovable, or amphithrosis, which is slightly movable. When we discuss cartilaginous joints, we mean adjoining bones united by cartilage. The two types of cartilaginous joints are synchondrosis and symphysis. A bar or plate of hyaline cartilage unites the bone at a synchondrosis. The most common example of a synchondrosis are of the epiphyseal plates in long bones of children. These plates are temporary joints. Another example of a synchondrosis is the movable joint between the costal cartilage of the first rib and the manubrium of the sternum. Synovial joints are adjoining bones covered with articular cartilage, separated by a joint cavity and enclosed within an articular capsule lined with synovial membrane. In simple terms, synovial joints have a fluid-filled joint cavity. All synovial joints are freely movable diastoses. Types of synovial joints include plane, condylar, hinge, saddle, pivot, and ball and socket.
Structures found in some diarthrosis. Bursae, that's a bag of a synovial fluid. It prevents wear and tear between ligaments and bones. And we know ligaments connect bone to bone. Then we have tendon sheath, which is actually bursae that is wrapped around the tendon, like a bun around a hot dog. It also prevents wear and tear. Flexion, extension, hyperextension, dorsiflexion, plantar flexion, abduction, adduction, circumduction, medial rotation, lateral rotation, inversion, eversion, elevation, depression. lateral flexion, left rotation, right rotation, protraction, retraction, opposition, pronation, supination. Homeostatic imbalances of joints. We have common joint injuries and inflammatory and degenerative conditions. Common joint injuries are sprains. That's actually stretch or tear of a ligament. If it's just a little tear, it will be fixed by itself. Cartilage injury, they don't fix themselves because they are avascular. And we have dislocations. That's when bone is forced out of a ligament. Bursitis is inflamed bursa. Tendonitis is inflamed tendon. Arthritis, there is osteoarthritis, wearing and tearing of articular cartilage. Rheumatoid arthritis is autoimmune disease when immune system attacks joints, degrading them. And gouty arthritis, uric acid crystallizes in joints, making up needles, which are causing the pain in joints.
Be sure to memorize this for your test.